So here's a thought. What if I told you that the biggest strain on a company's productivity isn't actually from the people who call in sick, but from the ones who show up to work every day? It sounds kind of backward, right? But it's this massive, hidden cost that's happening right under our noses, and believe me, it is costing businesses an absolute fortune.
I mean, you know the feeling, right? You're sitting there at your desk, you're technically working, but your mind is just somewhere else. Maybe you're fighting off a headache, or you're totally stressed out, or maybe you just didn't get enough sleep. We've all been there. Well, that feeling, that state of being physically present but mentally just gone, it's way more than just a bad day. It's this huge phenomenon, and it has a staggering price tag attached to it.
And this isn't just about feeling a little off. There's actually a name for it. And it's a concept that's seriously forcing businesses to rethink, well, pretty much everything they thought they knew about employee health and performance. Yeah, the term is presenteeism. And it's the total opposite of absenteeism, right? When someone's absent, you know it. Their desk is empty. But presenteeism, it's invisible. It's the employee who's physically there but just can't perform at their best. And because it's so sneaky and hard to spot, its true impact has been, frankly, underestimated for years. So just how big of a deal is this invisible problem? Well, let's put some numbers to it. And you might want to brace yourself. Okay, this is where the scale of the problem really hits you. Studies have shown that when an employee is struggling with presenteeism, their work efficiency can just plummet by up to 30%. Think about that. That's nearly a third of their productivity just gone. It's a massive loss. But here's the real kicker. The financial drain from presenteeism is almost 3 times greater than the cost of actual sick leave. And when you think about it, it kind of makes sense. An employee who stays home costs the company 1 day of work. But an employee who comes to work sick, they might drag on for days at partial capacity. They can make mistakes that take even more time to fix. And hey, they might even get other people sick. It's this hugely expensive ripple effect. So with a problem this big, the old way of doing things just isn't going to cut it. Companies are now turning to data to fight this hidden productivity killer. Let's dig into how they're doing it. Okay, a great example of this new data-driven strategy comes from a company called Pasona. They launched this platform called Wellness Cloud, and its whole purpose is to take this invisible problem and drag it out into the light, giving companies the tools they need to actually do something about it. So instead of just guessing what's wrong, it uses hard data. The platform pulls in everything, health checkup results, working hours, you name it, and centralizes it all. This creates this incredibly clear picture of the entire organization's health. And for the first time, managers can actually see where stress is building up or which teams might be struggling. Basically, it completely replaces guesswork with cold, hard evidence. Now, using an approach like this requires a really fundamental shift in mindset, especially for company leaders. It's all about completely reframing how we think about employee health in the first place. And this really gets to the heart of it. The old way of thinking was that employee health programs were just a cost, another line item on the budget. But the new view, it sees health as a core management issue. It's not a cost, it's an investment. And it's an investment that's expected to pay off. And that return on investment? Oh, it's huge. I mean, it's pretty simple. Healthier employees are more productive. They're also less likely to quit, and they have lower healthcare costs. On top of all that, a real focus on employee well-being can actually boost a company's ESG ratings. That's environmental, social, and governance, which makes them way more attractive to investors. It's a win-win-win. Okay, so all of this sounds great in theory, but you might be wondering, does it actually work in the real world? Well, let's look at some companies that are putting this exact philosophy into practice and seeing some pretty amazing results. I mean, look at this. The results really speak for themselves. You've got Shionogi & Company. They ran wellness events and saw lifestyle disease risk factors improve by more than 60%. That's incredible. Then there's Tanabe Mitsubishi Pharma. They focused on helping employees quit smoking and cut their smoking rate from 22% all the way down to just under 10. They literally cut it in half. And Sumitomo Forestry, they improved work-life balance with things like telework and better health checkups. This isn't just talk, it's tangible proof. So what's the common thread here? What links all these success stories? It's not just about offering nice perks, it's about measurement. They aren't just implementing these health policies, they are tracking them with real numerical data. Because at the end of the day, what gets measured is what gets managed. All right, so where does all this go from here? As the technology gets even more sophisticated, so do the possibilities. And, well, so do the tough questions that come with them. Believe it or not, the next step is already happening. Companies are now looking to integrate medical AI into these platforms. We're talking about systems that don't just collect data, but can actually find solutions automatically. They could diagnose organizational health issues and then prescribe fixes in real time. This is taking health management to a whole other level. And this, of course, brings us to a final, pretty provocative question. As these tools get more and more powerful, we really have to ask ourselves, how far is too far? Where do you draw the line between supportive health management and what feels like invasive surveillance? It's a really complex dilemma, and it's something we're all going to have to think about as we move into this new future of work.